My name is Doug Sigford. I'm an assistant professor here at the University of Louisville, and I perform a number of responsibilities here. I start in clinic and see patients, do surgeries. That occupies most of my time, but then I also spend a lot of time with residents and medical students working with their education. I really studied medicine kind of as a result of two things. Number one was I always really was fascinated by science and loved science. Loved taking things apart and putting them back together again, trying to figure out how everything worked, and that kind of developed into an interest in medicine and biology. And I also really loved working with people. Went to undergraduate school at Carleton College, which is a small school in Minnesota, and I studied physics there, which kind of gets back to my interest in science and technology. I was really fascinated in physics and with physics, and ultimately ended up going to graduate school and studied physics further there. Ultimately, though, I did kind of miss the human aspect of medicine and decided to go back to medical school where I could interact more with people. I'm a retina specialist, so I'm interested in retinal disease, treatment of retinal disease, and particularly in kind of advances in the diagnosis and treatment using more modern technology. What I enjoy the most, well, there's two things really. It's working with people, whether it's patients or with residents. I think the most important thing in caring for patients is to make sure that they understand the disease and what's going on, why we're doing what we're doing for treatment, and allowing them to participate in their own care. So I like to, first of all, make sure they know what we're doing and why we're doing it, and then second, participate in the decisions for potential avenues of treatment.